Hello and welcome to Healthcare in the Digital Age. My name is Dr. Chika Oriuwa. I'm a resident in psychiatry at the University of Toronto, and I have the honor of moderating this discussion today. I also have here with me Dr. Chidinma Nwakanma and Dr. Ken Lankin, and I'll allow them to introduce themselves in just a minute, but I'm going to give a background as to what today's discussion is going to be about. So social media can be a valuable tool for healthcare practitioners to engage with patients to improve health outcomes by disseminating accurate and credible health information, building positive provider-patient relationships to improve the patient care experience, improving the quality of healthcare delivery, and motivating patients to use best practices for a healthier lifestyle. Healthcare practitioners can also use social media to increase brand awareness, promote learning and development, and expand their professional network. Okay, so before we begin our discussion on social media and healthcare in the digital age, I would like to allow both Chidinma and Ken to introduce themselves.
Sure, I'll go first. My name is Dr. Chidinma Nwakanma, and I'm an emergency medicine physician, and I'm located in Philadelphia. I work for the University of Pennsylvania. And I'm just happy to be here. I think this is a very valuable discussion, and I think it's very timely. And yeah, let's have some fun.
That's great. Thanks, Chidinma. I'm Dr. Ken Lankin, and I was recently with JP Morgan Chase. I was in the Navy for 26 years and had a chance to travel around and see some of the technology grow out actually from some military operations and moving over into the healthcare space. Physically, I'm actually in Philadelphia today, and I'm so thankful to be part of the discussion today.
Amazing. Thank you both for introducing yourselves. And why don't we just jump right into some of the questions and let the conversation build. So first question, do you embrace social media in your practice? And if so, which platforms and how do you engage your audience? And if not, why?
I would say that I'm just starting to embrace social media. There was a long time where I was like really anti, Twitter and anti Instagram, and it's just too much, the machine and all that stuff. But now I'm starting to see that it does really have a huge impact, especially in medicine. Right now, I am utilizing the podcast platforms to kind of disseminate some information. I'm a part of a podcast called Emergency Medicine Remix. That's a plug, so go check out Emergency Medicine Remix. But we basically talk about healthcare issues that are affecting Black and Brown communities. And I also just joined Twitter like last month, and now trying to grow my brand as a physician and kind of promote the things that I'm passionate about, such as like COVID, vaccine hesitancy, vaccine distribution, and now most recently gun violence. So those are the two platforms that I'm on currently. I use Instagram and Facebook just for personal reasons. I don't know if I would say I'm using social media in my practice. I'm using it more for my professional brand and kind of influence, but I don't usually use social media for like patient care at all.
Yeah, that's an interesting way to kind of explore how our professional and kind of clinical personas can bleed into other realms, both personally and kind of in a public-facing manner. And what about yourself, Dr. Lankin?
Well, thanks, Dr. Chika. And I think that's a great viewpoint about this, the jumping back and forth between personal and your professional life, because there really is a spectrum of where they begin and end. So I think we're in a similar boat in that at least I've never worked for myself in medicine. I've worked for an employer. So you have to be very careful working for the military or a large corporation or even Penn Medicine, because what you say on public media becomes a matter of public record, and you have to be careful that you're speaking for yourself and not for your organization. Even if what you're saying isn't particularly controversial, it could still have impact. Even saying that somebody did a great job or whatever, if it's a competitor, it can cause issues. But I would say that I really use two platforms. So having said that, not being able to necessarily have my own blog, although that sounds great, and I will tune into yours. I do use Facebook and LinkedIn quite a lot, and I like LinkedIn more for professional messages, whether they're interesting articles. I tend to comment on things either in healthcare or as a public health physician, large issues, not specific issues. And I think it's a great way to grow your network, and you bump into like-minded people in public health. That's sort of the common area. But I do think there's a place on Facebook for personal reasons. So whether you're getting vaccinated or you're helping out with a project, these are great opportunities to expand your network. And I think it is exciting. I am really excited. Just as I'm leaving my company now, I actually got the largest, I couldn't believe it, posting that I ever had. All I did was post, but I've got our CEO's picture there, and we're almost up to 100,000 imprints, which was pretty amazing, and 1,400 likes. Usually, like if I hit 15 or 30, I'm pretty happy. Like when my cat died, I got 60.
Oh.
I'm sorry.
All the things in life. But anyway, it is a great way to grow, particularly, and I look forward to highlighting the Faces of Hope campaign on my own social media, just because you never know who knows or who might actually have an interest. It is shocking, really, how small the world is, particularly when we do get together online.
Mm-hmm. Can I jump in a little bit? Just because I wanted to make a touch on a part that Ken said, and just being careful about what you post online. And that was something that I feel like changed from when going from residency to becoming an attending. As a resident, or like as a medical student, I used to like post a lot about like patient encounters, not using patient names, but just like my frustrations or my happiness about different patient encounters. And I did feel like this new pressure come upon me when I graduated, like, okay, I got to be serious now because I'm representing an institution. So that is real. And I also wanted to say that TikTok is now growing as like the largest social media. And I really want to get on there because that's where you can get the youngsters. But my husband said I'm too old for TikTok. So I don't know if I'm going to be able to get on there anytime soon.
And that's a really interesting perspective, because, when we're talking about utilizing social media as an extension of our clinical care, kind of our professional brand, we really have to think about, what is the audience that we're trying to appeal to? Because if we're trying to improve vaccine hesitancy or in communities of color, then ideally you'd want to be targeting people who'd be potential patients. Whereas I find typically on Twitter, a lot of, at least in Canadian social medical Twitter, I find that there's a lot of like, you're kind of directing the discourse to other physicians.
Exactly.
And then maybe Instagram, LinkedIn, like it really depends on what the audience is and how it is that you can tailor your message to the specific audience that you're targeting. And so that can be really profound if you're trying to get on TikTok. Oh my gosh, I can hardly say it. I feel so old. And you're trying to appeal to, that generational gap, trying to, close that generational gap. And maybe you have something specifically for the youth, especially if you're interested in gun violence,
Yep.
if you're interested, in the disparities in community of color and really appealing to the youth. That is something that can be really important. And so, I guess where I'm going on with this, this long tangent, is that I just find that perspective that you both have to be really interesting, kind of how you can extend yourself professionally and otherwise, and how you kind of mitigate some of the risks involved with getting involved in social media. And so, given the growing impacts of social media, for better or for worse, how do practitioners still aim to advance care, especially to better meet the needs of the vulnerable community? Or I guess a better way to phrase that, how can we utilize social media to advance care for vulnerable communities?
I mean, I think that it kind of stems back to what we're talking about by reaching different demographics. Like, let's use my gun violence, like prevention stuff, for example. If that, gun violence, especially in Philadelphia, where I'm based, predominantly it's like Black males, demographics around maybe 15 to 45. That demographic is on Instagram heavy, honestly. So that demographic is on TikTok. And so when trying to strategize ways to combat violence, we definitely are going to be using social media. Majority of us are a little bit past the social media, like the people who are really, really in it. So we really have to enlist younger people to kind of get us to where we would be able to be palpable to a younger demographic. But we're definitely utilizing social media as a way to promote a campaign for gun violence prevention. And I think that that's an example of how in this age we can use that. I was on a conference call 2 days ago with one of the community leaders about gun violence. And he talked about in the 90s where, the only way that they could promote was like the newspaper and the radio, and like how much social media now has it's like astronomical how much reach social media has. And so any successful campaign that you want to do in medicine or otherwise has to utilize social media to be successful, in my opinion. So I think that the ways we can use social media, or the ways that we are using social media now, are to kind of reach a demographic that is predominantly on Instagram and the internet hours upon hours a day.
Right. And it kind of speaks to the idea of evolve or die or fall behind. Die is a little too harsh, but this world is increasingly becoming connected through social media. It is integral to the lifeline of our society. And so if you choose to opt out because you feel like, it's a generational thing, or it's not relevant, I don't know how to use it, I don't want to use TikTok, I don't want to use these things, you are going to miss a massive opportunity to connect. And Dr. Lankin, I'd love to give you the opportunity to speak further to this idea of how we can continue to utilize social media to address health equities.
Right. And so thank you for asking. I think the international reach is something interesting about this. So it could be something very local, like hitting some neighborhoods in Philadelphia, or it could be something literally getting to the furthest place that you can imagine, where people, thanks to the internet and technology, we could reach people in ways that were never possible. I don't think that telemedicine, for example, is brand new. I mean, we've had telephones for over 100 years, and physicians have been using that. And even 20, 30 years ago, we could do some kinds of things just using phones or radios or things like that. But now there's an exciting way to get in touch with people who've never had access to perhaps a physician, or to an idea, or to maybe a note about a particular health product. And I say this for two reasons. One, when I did have a tour working in Afghanistan, which is very poor and a very war-torn country, and struggling in many, many ways. They had the second worst maternal mortality, in the second worst in the world, actually. So a lot of very horrible medical things going on, partly because of the war and the poverty. But guess what? Aside from the government, what was the largest successful business in Afghanistan? It's actually the phones, cell phones, telecommunications. That is the largest profitable business in Afghanistan. People who don't have running water will have cell phones. And what's interesting, in preparing and reading, getting a little refresher on Nigeria, I saw that 75% of the population of Nigeria also has connectivity to the internet, mass media, etc. But the majority of them do it also through smartphones rather than laptops. So it is pretty fantastic that you could be at a little market somewhere. Of course, you could be in a big city, but you could be in a distant area, places that wouldn't see a physician for months or even years sometimes. And now through this channel, they could see, they can see you, they can interact with you, and they can see the messages that you have to offer. So I think it's a very exciting time.
Absolutely.
Even with its challenges and limitations, this is something that has not been able to have been accomplished before.
Right. And speaking to the challenges and the limitations, now in this COVID and for the foreseeable post-COVID future, where we are seeing this increased reliance on telemedicine in so many areas and specialties of medicine, what are some of your general thoughts as to the benefits, which you already alluded to? There are several, but also the issues that we may encounter as physicians, as healthcare providers, with regards to access and affordability for individuals who are wanting to participate in telemedicine.
I'll speak to that. I think that telemedicine is a gift and a curse. As an ER doctor, I didn't use telemedicine, so it's kind of hard. But I did feel the effects of telemedicine. I think the gift came because it opened up a new way and new access to people who, probably had issues with child care to get to their physician's offices, or didn't want to pay for parking, or couldn't pay for parking, or had problems with transportation. And now all of a sudden you could have a doctor speaking to you in your living room, and your child could be right next to you. And so I do think that it was definitely positive. In the ER, we were using telemedicine to track the symptoms of our COVID patients that we discharged. So the ones that we bring in, of course, they'd be in the hospitals, but the ones that we sent home, we'd have someone literally calling them or text messaging them every single day to ask, how are your symptoms? How are you feeling? What are you doing right now? And it'd be a really good way to see if someone's getting better or getting worse. And then we kind of refer them back to the ER if they were getting worse. So I do see the positives. I will say that there are a lot of negatives that I see as well. One, we were having increased ER visits because if you think about it, you're speaking to someone over some type a video screen, right? You can't see, you can't touch them, and you're really relying on the patient to give like a really cogent history and tell you what's going on with them. But patients lie. So it's really hard to like get a full story without seeing someone. There's so many times where I've had someone in the ER who's like, yeah, nothing's wrong with me. And I can make a diagnosis just from the smell walking into the room. And so you really miss that kind of smell, touch, sight that kind of informs you as to what else is going on. Because a lot of times there could be barriers to education, barriers to language, and that makes kind of just utilizing a verbal interaction very limiting. And then you can miss a lot of things that way. So I do think that there's some benefits to it, but I also was seeing like some of the negative effects to it. I did have a patient yesterday actually get referred into the ER just for a rectal exam because the doctor couldn't do a rectal exam over telemedicine. So they came to the ER, I did a rectal exam, and then I discharged them. And now that's like a whole ER visit just for something as mundane as a rectal exam. So I did see that there was kind of like positives and negatives to telemedicine.
Mm-hmm. Mm-hmm.
Yeah, I would agree with you, Chidinma. It is a blessing and a curse, or not necessarily a curse, but I think we just have to recognize the limitations of it. It is not a panacea for everything. So right off the bat, like my wife is actually in the dental field. I defy somebody to do, teledentistry right now, right? Like, okay, put the drill up on number 3. Okay, now turn it on, right? Like that's not going to work. Okay. Nope. Right. Okay. You're not doing endoscopy by telemedicine. You're not going to be doing, surgery, casting or things like that, obviously. And I do agree with you too. I mean, we learned in medical school, the most important test is the eyeball test. And you can't necessarily see the whole person on a screen, particularly if you are on a phone. And it does speak a little bit to the technology. For example, where I was working in New York, all the doctors had phones when COVID came down and everything was in lockdown, including the ERs, unless you were literally had like a, you know, a street pole in your chest. Going to the ER was not the place to go. And I had to admit, I sacrificed my own son, who, this sounds biblical, but he cut himself with a box cutter, getting one of those great Amazon impactions, beautiful laceration. But I knew we were in such a lockdown, it would be not advantageous to anybody to wait in line, you know, at the emergency room. So we did the best thing, and, you know, we did some butterflies, and I just told him to tell people later on, you know, he got it playing hockey or something. But nevertheless, right, you can't see everybody and everything. And the way people even say something too, it's so important to see them. Oh, what I was saying is that, like, okay, we have phones, but there's small phones, there's bigger phones. And one of the things we have in the office, or we had at JP Morgan Chase, is we had these beautiful telepresence screens. So the doctors love those because you could see in really vivid detail what the patient, what their surroundings were, if they had it. But to your point, if somebody says, how are you, you know, if you ask them, how are you feeling? And they say, oh, I feel pretty good. Well, what does that mean? You know, it could be, oh, pretty good, or yeah, I feel pretty good. You know, you just can't, you know, the words don't do it. You have to see it. And as you said, smell, sight. I honestly feel, again, just even being on public transportation, how many times can you make a diagnosis without even talking to somebody, just watching their gait? You can see a lot of how they're conducting each other. Having said that, I think there's still nevertheless the connectivity, just even to get somebody on the phone. So for mental health, simple things that can be done, and to at least get the connectivity. Maybe you can't get the help. Maybe you do have to go to the emergency room and get that rectal exam after all. But there's so many people who can't even connect. And I'll also speak for the veteran community. One of the underserved communities in the veteran community, we tend to think of the urban poor, but there's also a lot of rural poor and health disparities among rural veterans. You know, I'm lucky. I can walk to the VA, right? People that live in a city can hop on a subway and get to a veterans hospital, but that's not the case if you're a Native American and you live, you know, in the middle of Oklahoma. You know, it could be 6 hours for you just to get a visit. So I think the telephone, the telemedicine is an equalizer to at least get some kind of connectivity with the health system, even if it's not the definitive care that somebody needs.
Mm-hmm. I think I wanted to just piggyback on what you were saying earlier about, you know, you can go to the furthest parts of the world and this person has a phone. I think that there is truth to that, but it's also like telemedicine just does have a grand assumption that everyone has access to telephone or stable internet. And that's actually not the truth in these urban populations where I serve. And so I think that will further ostracize someone who doesn't have access to care, now being completely dependent on stable internet or making sure they pay their phone bills. And I also wanted to talk about like just the privacy issue as well. I don't think a lot of people think about the privacy issue when it comes to telemedicine. Culturally, there are a lot of households that are multi-generational. So there's multiple people living under one roof. And sometimes it might be hard to just go and get yourself in a secluded area without everyone in the house knowing your business. So I think that that's something that often goes overlooked when talking about like telemedicine. It sounds great, but I really do think that, and I'm not just trying to highlight the bad parts of it, but just the things that to think about, because we're talking about here, you know, further, you know, not allowing patients who are in vulnerable communities to have access, and how does it, you know, lead to more disparity. And these are the ways that it can. I'm not saying that that's for everyone, but just things to think about as far as when it comes to vulnerable communities.
Mm-hmm.
That's a good point.
So many rich takeaway messages already from this sub discussion. And I think an important thing that was kind of running through my mind as you guys were speaking was this idea of, what is the physician's job? And yes, we are diagnosticians, and our goal is to try and figure out what the diagnosis is. 70% of the diagnosis, maybe even higher, comes from a history and physical. The rest is like your clinical gestalt, and you use your labs and your other investigative measures to figure out what that diagnosis is. But I think a key component of what is missing, especially as someone who is in psychiatry, is that element of being able to be present and compassionate, and also that physical touch. Not everyone comforts a patient with a hand on a shoulder, or even like sitting at the bedside and, taking their hand, greeting them. But I know that, for myself and for a lot of the physicians that I try to emulate, that is such a big part of being able to be present and support the patient and uplift them and provide them with moral comfort, especially in times of distress. And unfortunately, a lot of that does get lost in transmission during, any kind of telemedicine, any kind of healthcare. And so I think that that's an important part. And if there's ways that we can, also evolve telemedicine, and I'm sure there will be better ways where we might be able to evolve it, then hopefully that's something that we can integrate, because the benefits of telemedicine are undeniable. I think especially during the pandemic, that's been highlighted. And yes, there are certainly massive issues with regards to access and equity. But at the same time, I think it's also opened up doors for so many patients who could not leave their homes for a variety of physical and mental health reasons that we now have access to that would have otherwise deteriorated in the community. And so I think it's definitely a double-edged sword in a sense, and hopefully the benefits outweigh the risks, and we can continue to change that ratio so that the risks and the kind of dropbacks are minimized. And so kind of pivoting back to this idea of social media as well, we constantly see misinformation being passed off as truth and going viral online. And I certainly know in this world of COVID, one of the things that has bothered me a lot as a doctor is seeing so much misinformation on social media. And, it's been really frustrating. I'm sure both of you must have, seen that or bore witness to that over the course of the past year and a half. So what are your ideas as to what you think the impacts of misinformation could be for communities who are already on the margin?
I think that the net effect is a negative effect. I feel that, for patients that already are on the margins, don't really have access to healthcare as readily as the general population, when you now have misinformation being spread out, you don't have a person who can dispel these myths. You don't have a person who can say, actually, no, that's not true, and here's why. You have people who are, ascribing to the University of WhatsApp and the Academy of Google, and and if you're Nigerian, I know, Ken, you said you were doing your research on Nigeria. If you're Nigerian, the aunties and the uncles, they want to send every manner of thing over WhatsApp and call it truth. And, if you don't have a person like my parents, my uncles, my aunts will send me stuff. And I'm like, that's not true, but if you don't have that in your family, if you don't have that with yourself, then you're going to just take whatever as truth. And especially with COVID, where it was just mass hysteria, mass fear, mass ignorance, so much new information coming out, people were being fed anything. And it was just really having this huge, huge, huge effect on especially patients that don't have access to primary care doctors. I'll give you an example. I had I believe he was a Liberian grandpa, so old and cute, come in with seizures because his sodium levels were so low because he read a WhatsApp text or article that said, if you wash out your body with several gallons of water a day, you can wash COVID out. So he was downing gallons and gallons of water, so much so that his sodium dropped so low and he came in having seizures. And that's the effect when you don't have someone saying, who can vet this, go to your doctor. A lot of people see things online and come into the ER or the primary care doctors and say, well, I read this. I don't know if this is true or not. And then I say, no, it's not. But if you don't have that, this is the only source of information you have. And it can be very, very detrimental and sometimes life-threatening. So I would say as an answer to that, there's a net negative effect. I don't think there's any positive to misinformation that's being spread rampantly on social media. So that is one of the downfalls of this information age that we're living in.
Mm-hmm. And certainly, I mean, commiserate highly with that idea of
WhatsApp.
The University of WhatsApp and the terrible misinformation that gets spread.
Oh yeah, Google. I Googled it, so it's true. And the sad part about it is a lot of these things are purposely designed as clickbait. I have to admit that I fell for one of these things myself. It wasn't a health issue, but it was a story about how Stanford University was founded, and it just tells this story of this just poor looking family, and they had lost their son at Harvard, and they wanted, and anyway, they refused, or they went to Harvard, I guess, and Harvard didn't want to give them the time of day, so they went to Stanford, and it turned out it was the Stanford family. They were wealthy millionaires, and they gave all the money to find Stanford University. There's only one problem. It's not true. But you want to believe it, right? Because it's like such a great story. Like I was actually telling people this story, and then I looked it up on Snopes one day, and I'm like, oh my God, it's not true. And I get these things from my father-in-law all the time too, who, God bless him, he's in his 80s, and he's on social media just as much as my 12-year-old, and he's always sending me stuff, right? Because it's on Facebook, it's true.
And kind of going back to what we were speaking about and the dangers of misinformation, I was just thinking about how also the political climate and kind of the distrust that can be seen in government and healthcare, and how that lays kind of a fertile ground for misinformation to be so readily absorbed by the general public. Because as Ken said, there are some people who are intentionally spreading misinformation and knowingly spreading misinformation. But it kind of gets into these subgroups, people who are already, skeptical of the government. And you don't even have to be that skeptical to accept misinformation, or to just readily grab onto anything else that is even seemingly subversive. But definitely when you kind of have that climate already, that socio-political climate of, we don't really trust the government, there must be conspiracy theory, and how can we trust their vaccines? They're trying to do mind control. They're trying to do all these various things. And it's, like I said, it's just fertile ground for misinformation. And then for the communities, as we said, that already have such little access to care and have such little access to family doctors, or even people in their family who can readily dispel these myths for them, then that's just a breeding ground, and it just festers, and people get deeper and deeper and deeper into these communities that all kind of think the same and all have that same rhetoric of mistrusting mistrusting the government, mistrusting physicians, healthcare systems in general, and it gets really, really problematic. But it's good to know that, and this is also why I think it's also really important for us as physicians to have some kind of presence on social media if it's something that you're interested in, because it can be such a powerful tool to run out the terrible rhetoric that's out there. And I know I've seen a lot of physician TikTokers who use these like 10-second clips to dispel these myths. And, and they make it nice and flashy and appealing to the youth, who are so impressionable, probably the most vulnerable to misinformation. So maybe this is just a plug for Dr. Nwakanma to go back on TikTok.
I'm going. I don't care. You guys are going to see me. I'm going to go viral.
I will download TikTok just to be your first follower. So
Thank you.
there you go. And so on that topic, as physicians, how do you use social media to leverage your learning and development and expand your professional network?
I think we kind of touched on this in the beginning about using it to definitely expand your network and your brand and whatever it is that your particular area of interest is at the time. I find Twitter to be very, very powerful. I didn't realize how powerful it was until I got on, and just putting one thing can just spread like wildfire. I've gotten so many speaking engagements, interview requests, just based on one post alone. And I think that using social media as a tool for branding is everything at this point for physicians in particular. I think as far as my learning, I would say, and I consider like podcasts and like those things social media as well. And so I think that that's been very, very helpful in just continuing to stay abreast of the new things that are coming out, the new articles, the new approaches to different disease processes, because I don't have time to read a book. I'm doing too many things. So if I can put it in my ears and drive to work, if I can put it in my ears and pretend to exercise in my living room, then that works for me. So I think podcasts in particular have been very, very beneficial for me as far as my learning goes, and as far as how I am continuing to engage in like clinical and the educational side of medicine, as opposed to sitting down with a textbook or looking through articles upon articles.
I think that's a great point, and I think the connectivity online, whether it's through whatever kind of social media, and there is that element of artificial intelligence. There's two sides to it. There's the creepy side that when I'm at work in my office in Manhattan, all of a sudden I get an ad. I'm doing research about, I don't know, hand sanitizer, and all of a sudden my whole screen's filled up with ads for vacuum cleaners. Now, yes, I am looking in the market for a vacuum cleaner. How you know that or why it's showing up at work, I don't know, and I think that's creepy. And but what's not creepy and helpful is when you are connected to learning opportunities, whether it's someone in a field that's similar to you or that's posting, or again, it's the power of connectivity that there really isn't 6 degrees of separation among us, really, when you start getting down to it. I mean, it was shocking, actually. I served in Afghanistan with a 25-year-old Air Force lieutenant who was killed in action, and I was actually getting ready to interview a physician about something else, totally different. And he saw that post, and he told me that he had gone to school with her brother. Right? I mean, it's just mind-boggling. And actually, to be honest with you, I wasn't going to interview him because but once he said that, it's like, how can I not? I mean, it's the connection's that close. So you just don't know how these connections are going to work their way out. And so I think it's a good thing. It's not. I know that we have enough ads in our lives, but I think it is enriching, and maybe to go off to the, maybe explore something that you might not have otherwise, because you do have a colleague or somebody that you respect that mentions it online.
I want to thank you both for sharing your incredible insights and for taking the time today to support the Faces of Hope campaign. I want to encourage everyone to head over and take a visit to the website, www.nhfinc.org, and please support in any way that you can. Dr. Nwakanma and Dr. Lankin, thank you so much for taking this opportunity to speak with us tonight and for supporting the Faces of Hope campaign.
My pleasure. Thank you for having me.
Thank you.